My name is Lakshika Udugama. I'm a speech and language therapist. I work at Sirimao Bandaranayaka Specialized Children Hospital, Peradeniya. So today I'm going to talk to you about Hanen approach. So this is one of the principles that we use as speech therapists when we are working with children. Basically, this is one of the ways that we use how to introduce quality interaction. So this is a very short session. So if you and as I am a speech and language therapist, I want you to speak. So let's look at it briefly. So this is a parent approach. So any parent can use this approach. So I'm not going to talk about all the principles, but I'll be touching on key principles here. And this is an intervention approach with you can use for children with language delay, autism, children with hearing impairment, Down syndrome, and other developmental disorders if the child is having. So we use natural environment. So that can be home, maybe school. So whatever environment that the child is at. And we have to provide more opportunities in daily activities. So this is a way to encourage the parents to give the children the opportunity to engage in day-to-day activities as well, using natural environment. So some of the principles that I'm talking about is from this book, It Takes Two to Talk. There are few books, but I'll be going through some of the key principles here. So in a summary, it can be said as rather than we telling the child how to play, let the child figure that out and always engage them actively, right? So how does this work? This approach helps the parents to modify the parent routine, how you interact with the child in day-to-day activities, and to encourage communication.
Somebody else and share with another person.
Yeah, so you can share your thoughts and feelings with somebody else. That's a very good way. So what else?
Convey your messages, thoughts and feelings, whatever you want to tell something else by verbally or non-verbally.
Yeah, verbally and non-verbally. That is a very good thing. So how can we communicate or express our feelings or thoughts? Can you shout out loud? How can we say? අපි කොහොමද අදහසක් හරි මොන හරි දෙයක් අවශ්‍යතාවයක් ප්‍රකාශ කරන්නේ? In Sinhala, English, Tamil, no problem. Please shout out loud. Whatever complete words, yeah. We use spoken language. Everyone does. What else? Gestures. Okay. What else? Come on. Facial expression. What else? Eye contact. Very good. What else? Body language, which I'm doing all the time. Yeah. Very good. What else? Written language. Very nice. What else? Pictures. Yes. Symbols. Yeah. That. So what else? So I think most of the things that you have already discussed. So pointing, because these are what we think like everybody talks, that doesn't mean that everyone can talk. So some children, as Dr. Nimisha also told, that 1/3 of the children who have autism have minimal spoken language. So what happened to the rest? So we are using speaking and non-verbal things to communicate someone what we feel like saying. So according to research, they have identified the majority of the things that we say 60 to 70%, whatever we say is understood by the other person by non-verbal things. 20 to 30% of the things that we say is understood by verbal spoken language. So I think now you see the gravity because we need both. But we sometimes ignore the non-verbal part. So before we start off, I would like to show you a small video clip and let's look at it and then go forward.
Did you know that children's most important language learning happens long before they can speak? Language learning starts when children have those back and forth conversations with their parents and caregivers in those very, very early days of life. From birth, babies start to have back and forth interactions with their parents by looking, making sounds, moving their bodies. And those early conversations are helping children learn the most important things they're going to need to know about how to be a conversation partner. They learn to pay attention to somebody. They learn to take a turn. They learn to respond when somebody else says something to them. And then they learn to take another turn. And there you have it. That's the beginning of conversations. As they get older, they learn to use gestures and they learn to use sounds more consistently, and eventually they learn to use words. So we can see that so much is learned in those early years, all about having conversations, and that's really the foundation for learning to speak. A study conducted by MIT showed that children aged 4 to 6 who had experienced more turn-taking in back and forth interactions with their caregivers had more activity in the part of the brain called Broca's area, responsible for language production and comprehension. This study clearly showed that the more conversations a child had with his or her caregiver, the greater amount of activity occurred in the brain in that important area. So this showed us something really important, because it's not just how many words a child hears that's important, but it's how many turns back and forth a child has while hearing those words. And it's really important that the child is participating in those conversations and not just listening to somebody else speak. So that's why quality is more important than quantity. It is important for children to hear lots of words, but it's the quality of the interaction in which the child hears those words that really is the most important part of helping a child learning to communicate.
So as you can see, it's all about the quality, not the quantity. So we for that, so we have to be responsive partners. And we are using 3A's method. So what do you mean by 3A? So first A is allow the child to lead. So when we talk about the Sri Lankan context, I usually use a common term to explain about play and everything to my kids' parents. That is Sri Lankan style play. So we have a unique way of playing with our kids. So that is what I call Sri Lankan style play. So what we do is we always give commands. පුතා අරක කරන්න මේක කරන්න ඔහොම නගින්න මෙහෙම නගින්න ඔය කෝප්පේ ඔහොම නෙවෙයි අල්ලන්න අනිත් පැත්තට අල්ලන්න. So we always give directions and instructions. Other thing what we do is we ask questions. Loads and loads of questions. මේක මොකද්ද අරක මොකද්ද අර කෝප්පෙන් මොකද්ද වෙන්නේ මේකෙන් කොහොමද වෙන්නේ මේ දොර මොකද්ද. So lot of questions. So it doesn't allow the child to play. So you have to make sure to be a responsive parent, like responsive partner in play, you have to allow the child to lead. The second thing is adapt to share the moment. So for example, if the child is doing something, for example, if I say it in Sinhala, then api පිහියක් අරගෙන මොනවා හරි කපන්න දෙනවා. If we have a plastic spoon, knife and then we cut something, ළමයා අනිත් පැත්තෙන් අල්ල ගන්නවා. what is our normal thing that we do? පුතා ඔහොම නෙවෙයි අල්ලගන්නේ අනිත් පැත්තෙන් අල්ලගන්න කියනවා. Right? So the child would not get the opportunity to learn මෙතනින් නෙවෙයි අල්ලගන්නේ අනිත් පැත්තෙන් අල්ලගන්න කියන එක. Right? Let the child figure it out. And then if you have another play item, so එයාට ඕනේ කපන්න නම් අපිට ඕනේ පාට කරන්න නම් what are we going to say? We say don't do this now පුතා, we'll finish our work. මගේ එක කරලා ඉවර වෙලා ඔයාගේ එක කරමු. So then what happened is child will lose the opportunity to play. So what you can do is adopt the child's and share that moment. If you want to cut vegetable, let's go ahead and cut the vegetable. So that you can make sure that you capture that moment and share that moment. So always adapt to child's play and add language and expression. So for that also I have a very funny story. Even sometimes we do when we play without knowing is using lot of some parents who come to me, I sometimes give them the chance to play in front of me. Not to mock them or anything, just to see how they play with the child at home. So what they do is, පුතා sit කරන්න, sit කරලා spoon එක ගන්න, spoon එකෙන් eat cake එක කපන්න, cake එක කපලා eat කරමු. So do you think it's appropriate or not? Just tell me if it's okay or not. I can't hear, maybe like I'm getting old, like can't hear. No, okay, right. This side, how about? Is it okay or not? No, because in Sinhala, so we are known as speech and language therapist. So we are, but we are named as Kata Misla, Kata Puhunu Misla. So we are named by that. But what we do is we are touching upon language. language කියලා කිව්වහම ගොඩක් වෙලාවට තියෙන දෙයක් තමයි language එකේ අපි බලන්නේ මොකද්ද කියන එක. එතකොට ගොඩක් වෙලාවට අහනවා පුතා වචන කතා කරනවද කියන එක. කතා කරන එකම හා වචන භාවිතා කරන එකෙන්ම අදහස් වෙන්නේ නැහැ ළමයා මේක දන්නවා කියන එක. language කිව්වහම ඒකේ අපි areas ගොඩක් බලනවා. එකක් එයාගේ vocabulary එක තියනවද කියන එක. ඊළඟට එයාට ඒ වචන තේරෙනවද කියන එක. Can the child understand that? If the child can understand the words, can the child understand the meaning? ඊළඟට වචන හරියට ගලපලා කියන්න පුළුවන් ද වාක්‍යයක කියන එක. So syntax. ඊළඟට සමහර වෙලාවට අපි කතා කරනකොට කෑලි අගට දානවානේ. නිපාත කියනවා. අම්මයි තාත්තයි ගියා. අයියටයි මටයි වань. ඒ වගේ. So sometimes they will miss out things that we call morphemes. Right? And if the child has everything, sometimes they don't know how to talk to different people in different way. We call it pragmatics. So we have to see each component is age appropriate to that particular in comparison to peers. If so, then we'd say, okay, language is age appropriate. If not, please do refer speech and language therapist and get a proper assessment done and make sure that we get the chance to work with the child. And I would love to request, this is a kind request, don't send them after 8 or 10 years because it's very difficult to teach something. Because in language development milestones, the first 3 years are the golden 3 years. So it happens is like it goes, they can absorb like a sponge. Mama kiyana ara sponge ekකට වතුර දැම්මම අල්ලගන්නේ. So that fast the children pick up. And 4 to 5, they have a improvement. But compared to 3 years, that is less, but it is improving. So we have to capture this 5-year period. සමහර වෙලාවට මොන්ටිසෝරි දැම්මම හරි කියලා කියන වෙලාවල් තියෙනවා, but that is very less now. But please make sure we don't give any medicine or anything. So just send it to us. So if the child is okay, we say okay because we have a very large caseload. So we are happy to send them off if they don't have a problem. So it is good to send them if they are not talking in a particular age milestone, right? So, and also language expression, when I talk about Singlish, අපි ගොඩක් වෙලාවට මොනොලින්ගුවල් නෑනේ දැන් ගොඩක් වෙලාවට බයිලින්ගුවල් හරි මල්ටිලින්ගුවල් හරි භාෂා දෙක තුනක් කතා කරන ෆැමිලිස් තමයි තියෙන්නේ. So language structure එක ගත්තාම සිංහල language structure එක, ඒ කියන්නේ language එකක් ළමෙක් වචන වාක්‍යයක් හදන විදිහයි ඉංග්‍රීසියෙන් වාක්‍යයක් හදන විදිහයි සම්පූර්ණයෙන්ම ඒ කියන්නේ අනිත් පැත්ත තියෙන්නේ. එතකොට you Singlish words, because you know that you can always form a single word in English perfectly because you know all. But when a child has Singlish environment and they go start using it, it makes syntactic error. If you are advising this nowadays our generation parents to talk, ask them to talk not Singlish or Tamilish, just talk the Sinhala or English words, sentence separate, right? But don't use that bara language. So, fridge, don't use cheetah karne. Don't use that. But whatever you use in day-to-day things, but not Singlish or Tamil. Okay? So next, move on to the next one. We have another thing called owl. Owl can have nikang owl name, but we have meaning for each letter. So O means observe. W means wait. L means listen. So O means what your child is interested in. Wait is very, very important. Stop talking, right? You have to wait and just lean forward and then look at the child expectantly. So sometimes as speech and language therapist, I often talk more when I play and when I see a recording myself. I tend to steal some of the opportunities when the child is talking. So even for us it happens. It's normal. But try to minimize that as much as possible. Waiting is very important. And then listen. You have to be an active listener. If your child is not saying the whole word, like car ekata ka kiyanana, ball eta bo kiyanana, know that it is also important. That will help to gradually build up the words. Okay, and then listen to that and then respond. So one of the tips that I say to my parents is count to 5 seconds and then respond. So 1, 2, 3, 4, 5. At least wait that much. For if you have a child with a if you're working with a child with a cerebral palsy also, the normal recommendation is 15 to 30 seconds even. So that's quite a lot one. Okay, so at least just think, count to 5 in your head and then respond. Okay, so let's see what is quality interaction.
So what is a quality interaction? A quality interaction is one where the adult observes, waits and listens and gives the child a chance to communicate or to do something that shows what he or she is interested in. That means the adult doesn't speak, sits back and gives the child a chance to communicate. Once the child takes that first turn, the adult then responds, following the child's lead and saying or doing something that's directly related to what the child has communicated. They wait again, and then the child communicates again. And this leads to that back and forth interaction that is so important. And these kinds of interactions also give children a chance to talk about things, to ask questions, to express opinions, to express their ideas. And that's really what a quality interaction is all about.
Now let's look at what some of the other things that you can do to create more opportunities to communicate. One thing that we have discussed is owl. Observe, wait, and listen. The next one is try to be at the face-to-face level. What we need to understand is if they are up and if the child is down, it is very difficult for them to see. So make sure whenever you do and interact with the child, make sure you go to their level so that they will get more opportunities to look at you and then read your facial expressions and try to interact with you instead of you are up and there's a discontinuity. And if the child is having autism, especially, they won't look at you initially. So you have to make more opportunities for the child to make sure that they look at your face and then interact with you. Then another thing is imitation. Imitation can be the expressions, the things that the child makes sound, words and their actions. So what we can do is simply to remember that what you can think about is I will do whatever you do, right? So if the child is banging something, you do the same thing and you wait and let the child to imitate back. So it is very important to imitate something the child does or rather than you are introducing something and then let the child imitate. First, if the child is imitating, then it is easy for the child to follow because he has been doing it for some time. The next one we'll be talking about, I'm rushing it because we have a very interesting talk coming up. Yeah. Okay, madam. Right. So, interpret. So, what do we mean by interpret? So, sometimes, can you see small kids show things when you go out? Like, if you don't have kids, that's fine. But you have seen kids going around and then showing stuff to parents and adults and everyone. Right? So, what you say when child is showing would give them ample opportunity to learn language and vocabulary. So you can interpret what they are seeing and how they are seeing. So that will help the child to increase the curiosity and learn the word naturally, right? I would like to say another one, that when children are asked to introduce words like vocabulary, අපේ අම්මලා තාත්තලා කරන්නේ බස් කන්ඩක්ටර්ස්ලා කරනවා වගේ දැන් ගාල්ල කියනවා වගේ බෝලේ කියන්න පුතේ බෝලේ කියනවා, right? That is how most of the parents tell. But if you tell it like this is a ball, මේක බෝලයක්, අප්පච්චි තමයි බෝලේ ගෙනාවේ, මේ බෝලේ ලොකු බෝලයක්, මේ බෝලෙන් අම්මයි බබයි සෙල්ලම් කරමු, ඊළඟ දවසේ යනකොට තව බෝලයක් ගමු. So if you say that, how many times that you hear the word ball? Multiple times. That is how the children would pick up language and keywords from their natural environment instead of saying like ball, ball, ball. Oh, what's ball? And then you can expand on what the child is saying. So if the child says one word like if it's a ball, ඔයාලත් බෝලේ කියලාම නතර වෙන්න එපා. Don't say බෝලේ. මේක ලොකු බෝලයක්. බෝලේ වැටුණා. So you say it's something else, add it up, so the child would get an expansion of the language. And you can label it with different word forms. Like it can be juice එක නා රස juice එකක්, පළතුරු juice එකක්, නැත්නම් මොනවාද සීතලයි නේද? So use that appropriate words, so that child would pick it up naturally. You can comment about it. So, the next one is include your child's interest. So that we have discussed already, that you have to identify what are the things that the child is interested in. So use that as an advantage to improve their attention for a little bit longer time. If you do something that you really want when you are a child, that doesn't suit your child, or that child might have different interests to toys, things, objects, maybe food. So make sure that you identify that parents are the best person of their child. We are not the expert. We know it. We can facilitate, but we can't replace parents. So parents are the best people to understand and identify what are the things that child likes. So use that to create more opportunities. The next thing is join in and play. This is very, very important. Just because we tend to play, that doesn't mean that playing is fun, right? Engage with the child and make it a play activity. So it can be anything. Sometimes parents come and ask, මිස් දෙන්න පුළුවන්ද සෙල්ලම් ලයිස්තුවක් ළමයාත් එක්ක කරන්න. So often everyone, like majority of my kids parents would ask, සෙල්ලම් ලයිස්තුවක් දෙන්න පුළුවන්ද? නැත්තම් sometimes they do 2 to 3 activities at home. Like අර තුන් වේල බත් කනවා වගේ. So ball passing is one very important thing that comes to their mind. බෝල ගහන එකයි, සබම් බෝල එකයි. Sometimes some parents have other one like cookery set hari මොනවා හරි තියෙනවා. තේ හදනවා. Every day තේ හදනවා, උදේටත් තේ, දවල්ටත් තේ, රාටත් තේ. So they don't have a diversity, right? So different play activities will improve different skills. So what we can tell, okay, I don't know the toys that you have at home. What I usually tell my parents is, you prepare a playlist and come. So we can modify it a little bit, and then they have a unique play activity list with them so that they can use it. And always engage, include them in day-to-day activities. It will make the work double time and make your life little bit harder. But අතුගානකොට එයාට ලොකු කොස්සනේ ඕනේ ගොඩක් වෙලාවට. So give the මේ ලොකු කොස්ස දෙන්න එයාට අම්මගේ වාරේ බබාගේ වාරේ. So likewise you can engage, like if you are washing something or if you are taking clothes from the from the washing machine, you can do that. It is all about your imagination. Anything can be a play activity if you think about it. And then create lot of opportunities in day-to-day activities. Like I said, it can be swinging, onchili paddana vela wenna puluwan. It can be food time, meal time, bathing time, sleeping time, story time, or any time can be a opportunity creating a thing for the child to communicate, right? And last but not least, very important thing is screen time. So most of the parents think it is very cool to give lot of educational cartoons, things like that, to educate the children, to give more English language opportunities instead of parents talking. So please make sure that they are not substituting. Tabs or computers or phones are not a substitution for mother or father. So for below 2 years below, don't give screen time at all, I would say. And then 2 to 5, less than 1 hour with adult supervision. You're not giving the TV and going somewhere and doing stuff and come back. With adult supervision, you have to talk while you show the clip, so that they get some sort of an interaction. If not, please avoid it. That can create more problems, and it is very difficult to restrict the children. They will have a lot of behavior issues, right? And this is a video that I'm going to show last. So the first bit is how the parent and child interacts before they are using Hanen principles, that things that we have discussed now. And the next part, that latter part would talk about how it has improved play when she's using some of the things.
Now let's watch the first video and see how mom interacts with her daughter before she starts using Hanen strategies.
Let's wash the plate. Are you bringing stuff for me to wash?
Yeah.
Okay.
Time.
Put the corn in the water. Spoon in the water. I'm gonna squeeze my sponge again. Watch. Look at all the water come out. Oops! Don't do that. Keep the water in here. No. Okay. Don't make a mess with the water. You have to keep it in here. No dumping water. No dumping water.
So you could see that mom was doing a lot of great things. She was down on the floor at her child's level and joining in on her play, which is a great start for setting up an interaction. But you may also have noticed that her daughter wasn't taking a lot of turns in the interaction and didn't seem to be having a lot of fun. The Hanen approach is about letting the child lead and encouraging the child to take first turns in interactions and many back and forth turns in that interaction. We know this is what helps children learn to communicate. And you'll see just how much language this little girl is using compared to what she used in the first video.
Fries.
You're making fries.
Pizza.
Pizza. Yum. Can I have some?
Yeah.
Thank you.
Me.
You're gonna have some too. More pizza.
Fries.
More fries. Thank you.
These are the high-quality interactions that allow children to communicate, to practice their language, and to learn better language skills.
So, if the take-home messages are, helping children to communicate is not a straightforward path. You don't have a manual. So you have to go with the flow, right? We need to find the recipe that works best for your each child. And this is a parent approach. This is not only, this approach does not limit to work with children with autism, but also speech delay, if they have multiple disability conditions, we can work with these children. Natural environment is the key, and more opportunities needs to be given in day-to-day activities. And if there is any red flag sign, if the child is not talking by the age of 1, and if the child is not combining words by 2 years, or if the child is not saying it combination of 3-word utterance by 3 years, please make sure that you refer to a speech and language therapist and get the assessment and start working on the child. So early intervention leads to a better outcome. These are my references. Thank you very much for listening.
දරුවා එකමදේ නැවත නැවත කිරීම, සෙල්ලම් බඩු එක දිගට තැබීම, ඕටිසම් තත්ත්වයේ ලක්ෂණයක් විය හැකි. ඕටිසම් ලදරුවියේදීම හඳුනාගතහොත් හොඳින් පාලනය කළ හැකි. නොපමාව අමතන්න 117.493 SLACD සහ CDB සාමූහික මෙහෙවරක්.
If your child focuses on things in a repetitive or obsessive way, it could be a sign of autism. Autism can be successfully managed if identified at an early age. Call our helpline on 0117 490000, a joint effort by the SLACD and CDB.
குழந்தை மீண்டும் மீண்டும் ஒரே செயலை செய்தல், விளையாட்டு பொருட்களை ஒரே வரிசையாக அடுக்குதல் ஓட்டிசத்தின் அறிகுறியாக இருக்கலாம். ஓட்டிசத்தை சிறு வயதிலேயே இனங்கண்டு கொண்டால் அதனை கட்டுப்படுத்தலாம். தாமதியாது அலையுங்கள் 0117 490 0000. இது SLACD மற்றும் CDB இணைந்து செயற்திட்டம்.